Hi. Today we're going to talk about gut health. Did you know that you have a second brain and it's located in your gut? Yeah, your gut. Can you believe it? Well, I know it's hard to believe, but it's true. Your gut actually begins at your mouth and ends at your rectum. And it's responsible for so many complex mechanisms: digestion, absorption, excretion, and it has an effect on so many parts of your body, like your immune system, your energy levels, even your mental health. Can you believe it? Well, you know what? We're going to talk about that today and answer all your gut related questions and even your non gut related questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in your health related questions and we answer them. I'm Dr. Kamaljit Kaur, and I'm a concierge primary care physician here in South Florida. Today's first question comes to us from Skip, and Skip has reached out to us through our website, allhealthtv.com. Skip's question is, "Hey doc, my wife started drinking that kombucha stuff, and now she keeps nagging me to start taking prebiotics and probiotics. They sound alike, so is there really a difference? And which is better for the gut?" Skip, I'm going to say, as a wife myself, you should listen to your wife. We love you guys, and this is why we do the nagging. And she sounds like a smart cookie, so I think you're pretty lucky. Before I get into pre and probiotics, though, let's check out this video from our friends at the Mayo Clinic.
Fermented foods are all the rage, but are they really healthy?
Whenever we take what's a natural product, we do have to be aware there's good and bad potential.
Mayo Clinic's Dr. Joseph Murray says fermented foods such as kimchi or the tea product called kombucha contain prebiotics that encourage the growth of good bugs, which may promote health and aid digestion.
Which for people with some digestive complaints can help them feel better, maybe have a more regular bowel habit. But it's not to be underestimated. Some people don't tolerate it so well.
These foods may help treat diarrhea, prevent and treat urinary tract, yeast, and intestinal infections, help manage irritable bowel syndrome, and may shorten the severity of a cold or flu.
We have a community of bugs that live in us, and on us.
Researchers continue to learn more about the benefits and risks of fermented foods. For the Mayo Clinic News Network, I'm Vivian Williams.
So as you can see, that video is chock full of a lot of great information about our gut microbiome and the little critters that live in there and make up our gut microflora. Now, before I get into more detail about what a pre and a probiotic are, I think it's important for us to all realize that just like the video said, our guts are made up of a bunch of microorganisms. And even though a lot of times microorganisms like bacteria and fungi get a bad rap, we have good ones that live within us and on our skin actually, and help promote good, healthy mechanisms in the body. So in order to really help this community of microorganisms flourish and do their best, sometimes it's recommended to take prebiotics and probiotics. And basically, they help in different ways to promote the growth of these good organisms and to really help them what they need to do. So as far as prebiotics go, these are generally foods that are complex carbohydrates and high in fiber, and they are fuel for the little critters inside, honestly. And with those foods, your body is going to absorb the nutrients in them and then help the microorganisms that are beneficial grow in your gut. So what are probiotics? Well, probiotics are the actual live microorganisms. And these, like I said, they do work differently, but you can't have one without the other. Just like a car needs fuel and your body needs food for fuel, the microorganisms also need fuel to grow and to do what they need to do. Did you also know that these microorganisms are so helpful, not just for digestion and making sure you have a bowel movement on a regular basis, but they help with mechanisms in optimizing your immune system, your mental health, your cardiovascular system, your endocrine system, your nervous system, pretty much everything. So you really, really want to make sure that you're doing what you can and living a healthy lifestyle so you're getting those probiotics and those prebiotics naturally. Now, how do you do this? Eat healthy, plant-based foods, exercise regularly, sleep adequately, minimize your stress levels. Basically, try to be as healthy as possible. So let's go to our next question now. And this one comes to us from YouTube, and this is from Davina. Davina asks, "Hi, Dr. K. My husband, Andy, is currently on antibiotics. So my sister calls and says he should be eating yogurt while he's on the antibiotics. And he's not a big fan of yogurt, so I'm wondering why he needs it." Davina, that's a wonderful question. And your sister is absolutely right. Now, while it may not be necessary to just have yogurt, the theory behind this is for him to have some kind of probiotics while he's taking antibiotics. Now, most of us are familiar with antibiotics, right? You have an infection and it's usually caused by a bad bacteria. So the doctor gives you antibiotics to help fight it off and help kill those bad bacteria. And what happens, and this is unintentional, of course, but when you're taking an antibiotic, not only are you getting rid of the bad bacteria, but you're also getting rid of the good bacteria on your body and in your gut. And that can lead to some unwanted side effects, as some of us have probably experienced, like diarrhea, abdominal cramps, or nausea, and just not feeling great when you're on an antibiotic, even though you think this is getting rid of my infection, right? You're supposed to be feeling better. So that's kind of the unintended consequence of antibiotics. Now, we recommend that while patients are on antibiotics, they also take probiotic, and that could be in the form of yogurt with live cultures. It could be through kefir, fermented foods like sauerkraut or kimchi. There's a whole variety of them, but I'm going to be honest with you personally, yogurt is probably the easiest one to down. When you're not feeling well, you really don't feel like eating much, right? So some of those other foods might be too much for your palate. So yogurt is kind of benign. And when you are taking any form of probiotic with an antibiotic, we recommend taking it maybe about an hour or two, ideally 2 hours after or before taking your antibiotic, because you don't want them to kind of cancel each other out, right? So you got to be mindful of that. All right, let's see. We have another question here, and this one comes to us through our website again. I hope you guys had a chance to go on the website, allhealthtv.com. There's a lot of great information on there, and you can also send us your questions through there. This one comes to us from Monica Lynn, and it looks like we're going to change lanes here a little bit. Monica Lynn asks us, "Dr. Kaur, my little sister Angie was recently diagnosed with borderline personality disorder. What is it and what causes it?" Monica, I'm so sorry to hear that she has this diagnosis now, but I'm glad that she was diagnosed, because when you know what the problem is, then you can treat it appropriately. Now, bipolar personality disorder is a mental health disorder that compiles a couple different things. It can be characterized by someone who's having instability in their interpersonal relationships, someone who's having instability sometimes with their own relationship with themselves and their self-image. Their emotions could be a little volatile as well. Their behavior might be impulsive in certain situations or in a lot of situations. But overall, the set of symptoms starts to really limit the person's day-to-day routine and their life in general. And that's when it starts to cause significant impairment, and we define it as bipolar personality disorder. Though research has not yet defined any one single cause of this disorder, we are familiar with several different factors that may contribute to its development. Now, here are some possible causes of borderline personality disorder. The first one I'm going to go over is the genetic causes. Bipolar personality disorder does have a tendency to run in families, so it can be inherited. The next factor is problems or dysfunction in your brain chemicals. It's thought that many people with bipolar personality disorder have something wrong with the neurotransmitters in their brain, the neuropeptides, basically the messengers of your nervous system, and it limits their ability to work appropriately. The next factor is problems with brain development overall. Now, MRI scans have revealed that in many people with bipolar personality disorder, three parts of the brain were either small or didn't have much activity or unusual levels of activity. One of the centers, and the first one I want to mention, is the amygdala. Now, this is the emotional center of your brain. The next one is the hippocampus, which is a center of your brain that is mostly responsible for cognitive and rational functioning and thinking. Then the third one is the orbitofrontal cortex. Now, this part of your brain is quite complex and it's responsible for a wide variety of functions. The next one I want to talk about, the next risk factor, is environmental factors. Now, these environmental factors seem to be common among people with bipolar disorder, but it's not necessary that everybody with bipolar disorder will have had these. These can include emotional, physical, or sexual trauma or abuse in childhood or at a previous stage in life. Long-term fear or distress as a child can also be a risk factor. So as you can see, it's multifactorial, the disease, but I'm very glad she got diagnosed and I really hope she gets the care that she needs. Now, in case you missed it the first time, here's how you can send us your questions and your inquiries.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, we're back on track. And this Instagram question comes to us from Conchita. Conchita's question is, Dr. Kaur, can you help me, please? My doctor told me that my gut microbiome was compromised. Then he used some big words to try and explain what gut microbiome is. He lost me at gut. Can you tell me what it is and how I can fix it? I would love to. Conchita, this is a really great question, and I'd be happy to explain what the gut microbiome is a little bit more in detail. But first, let's check out this video from the Cleveland Clinic.
What's interesting is I didn't try to study the gut. What I've always been trying to study is what are the factors that contribute to what we call residual cardiovascular risk. After you take care of high blood pressure and diabetes and high cholesterol and obesity and all of the risk factors, we still see that over 50% of cardiac events continue to happen. We call that residual cardiovascular disease risk. We collect blood samples and follow people over time and then see, can we find chemical signatures in the blood that predict the future development of disease. Repeatedly, the molecules that we keep finding are arising from gut microbes and the food that we eat. One of the major ways that our microbiome contributes to our health is by generating compounds that are good for us, but also compounds that are bad for us. They tend to come from protein, and some of the compounds that we have found that track with future risk almost exclusively are found in red meat. You can use this information to personalize dietary recommendations. What we eat has a huge impact on our health. Maintaining a healthy diet is just as, if not more important, than taking the medications that we do for treating disease.
That was a great video, and it really emphasized the importance of a healthy diet on our gut microbiome. That's how we get all our vitamins and our minerals and the enzymes and things that we need for the gut microbiome to work appropriately. But back to your question, what is the gut microbiome? So think of it as a community of microorganisms. And the community is made up of bacteria, of fungi, and of different little critters that work in harmony to really optimize your health systems. Now, one of the most impactful roles of the gut microbiome is in maintaining your immune system. These good organisms can help by eliminating and fighting off the bad ones. And when this function is inhibited, you'll see somebody who has recurrent infections or recurrent dysfunction of their immune system. Now, a whole host of infections can be caused by this. And if you remember, one of the previous videos did mention urinary tract and yeast infections, and that's very true as well. Now, just like infections, the immune system also has its hand in other functioning in our body, right? But then you also have the cardiovascular system, the endocrine system. All of these work in conjunction with our gut microbiome to keep us healthy. When your gut microbiome is off, not only is your immune system affected, but you can also be at risk for diabetes, for obesity, for heart conditions, asthma, and for mental health conditions as well. And, even skin issues like eczema and acne can result from a dysfunctional gut microbiome. This is why it's so important that your gut microbiome is appropriately supported. And you can do this by eating things like nutritious foods, foods that are mostly plant-based, exercising regularly, sleeping, reducing your stress, all of those good things. So your gut microbiome is pretty important, and we're giving more focus to it in the medical society because now we're realizing how important it is. All right, friends, it looks like we finally have a Facebook question, and it's from Butch. Butch asks, "Hi, Dr. Kaur. I've been feeling a little out of sorts lately. Migraines, upset stomach, and problems sleeping. My girlfriend Lexi, who's studying to be a nutritionist, thinks my gut is out of whack. What are some of the common signs of an unhealthy gut?" Butch, you just rattled off 3 of them yourself. Those are very much signs of an unhealthy gut. Migraines, upset stomach, sleeping issues. I'm going to put up a graphic that shows a little bit more about what these factors are, what these symptoms are that you can experience when you have an unhealthy gut. So let's take a look at them. Number 1 is stomach issues. So gas, bloating, constipation, diarrhea, these are all signs that, when your digestive system is off, that's what you're feeling. And I'm sure a lot of us feel that sometimes. The next one that I want to talk about is number 2. You feel more tired more often than not. And that's because your gut microbiome is off. So you're not getting the vitamins and the minerals that you need to have those high energy levels and get up and go and do your daily routine. The next one I want to talk about is number 3, trouble sleeping. Now, this is a very common one that is often overlooked when people have issues sleeping, because we think about, what are your stress levels? Do you drink caffeine? All these other factors as to what could be affecting your sleep. And a lot of times we ignore the foods that we're eating can also affect our sleep. The next one is, just as I mentioned with foods, number 4, intolerance to certain foods. So when your body's not accepting certain foods and is rejecting them and showing you symptoms that I'm not happy with this, you can be affected in many ways, many ways. And you'll see that sometimes patients will say, well, I can't eat that anymore because it doesn't make me feel well. The next one I want to talk about is number 5, extreme food cravings, especially sugar. So sugar is addictive. We all know this. I mean, when you have a piece of candy, you can't just have one. You usually want more. And when it comes to cake and desserts and pies, but sugar in moderation is okay. When you are craving a lot of sugar, that is a sign that something's going off in the body. Simply put, and this is kind of just my rule of thumb and theory, bacteria love sugar. Glucose in any form is one of the fuels for bacteria, especially bad bacteria. So when you're really craving sugar, it's kind of a sign that you have a lot of bad stuff going on in the gut. The next one I want to talk about is number 6, unintentional weight gain or weight loss. And this kind of comes back to the food intolerances as well, because you're not eating as healthy as you should be eating, and your body's rejecting some foods. Well, then naturally your weight is going to fluctuate as well. And this may be drastic, 5 to 10 pounds, or maybe just 1 to 2 pounds. Any kind of a weight change can be a sign that your gut microbiome is a little bit off. The next one, which may surprise you, is number 7, and these are skin irritations. So like I mentioned earlier, eczema, acne, these are some of the signs that your body is reacting to something and something's going on inside that just isn't sitting well. The next one is something that we see very commonly, and something that you mentioned is number 8, migraine headaches. I know people who have migraines, and migraine headaches can be very easy to trigger. So one of the first things we tell people who have been diagnosed with migraines or who fight lifelong migraines is watch what you eat, because certain foods can trigger them. And each individual patient that I have who has migraines can usually tell me, oh, I can't drink red wine, that sets off my migraines, or I can't do this, that sets off my migraines. So really, that your body, is in tune with all the gut microbiome and the bacteria in there and the effects that it can have. The next one we've talked a little bit about, the immune system. Number 9, that falls under autoimmune conditions. Did you know that almost 70% of your immune system is in your gut? So it's needless to say that when you're having an imbalance of your gut microbiome, that's going to affect your immune system and may even lead to some autoimmune conditions. And the last one, which is definitely not least, number 10, is frequent mood changes. As we've mentioned, having an alteration in your good gut microbiome, bacteria, and fungi can definitely affect how your mood feels. Now, these are all signs that something is going on in the gut, right? And we really, again, emphasize that the best way to prevent this or to treat it is by eating healthy and promoting those good bacteria from flourishing. So just imagine, I mean, 70% of your immune system is in your gut. Some studies have shown that you have more neurons and nervous system receptors in your gut than you do in your spine even. So you can imagine when it's out of whack, you're going to feel all sorts of things. Now let's get to our next question. And we have a really interesting one here from Facebook. And this comes to us from Maris, who asks, Dr. Kaur, I've been diagnosed with hand, foot, and mouth disease. Can you please tell me how long it's going to take for my horrible sore throat to go away? I'm on day 5 and it's just not improving. I'm so sorry to hear that, Maris. Hand, foot, and mouth it's annoying, honestly. It's a benign condition, so your body will heal it on its own with time. And generally, like most other viruses, that takes about 7 to 10 days. But it is annoying and it's sometimes very difficult to go through. So I feel for you and I wish you a speedy recovery. Now, what can you do to help aid that recovery? Well, you want to eat healthy, you want to stay hydrated, you want to be well rested, but you can also sometimes take over-the-counter medications like Tylenol or ibuprofen. You want to check with your PCP though, because sometimes it's not safe for you to take those medications depending on your other health conditions. So definitely ask your doctor. Unfortunately, we haven't found one particular antiviral medication that treats this condition. But luckily, like I said earlier, it is benign and most of the time, a healthy body can fight it off on its own. It's just annoying. I'm so sorry. All right, guys, if you've got questions, we've got answers. And in case you missed it the first time, here's how you can send us in more of your healthcare related questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We've got another question from our website, allhealthtv.com. You know, like I said earlier, I hope you guys are checking out the website. It's got a lot of great information. This question comes to us from Kalista, and Kalista asks, Dr. Kaur, I've been having some stomach issues lately. So I went to my GI guy and I told him that in addition to the usual stomach stuff, I was also feeling kind of anxious and depressed. He said that my gut could have something to do with it. Does that seem as crazy to you as it does to me? Kalisa, I know it may seem strange, but he's very much right. There's definitely a correlation between your gut microbiome and your mental health. Did you know that serotonin, the happy hormone, is primarily produced in your gut? I mean, wow. I'm not going to lie. We weren't taught that when I was in medical school eons ago. But more and more research has been coming out in the last decade that proves this. So it's no wonder when your gut is off, your mental health is totally off. And again, how do we treat it? We got to restore that gut microbiome. Now, in addition to serotonin, another neurotransmitter called GABA, which a lot of us are familiar with, is also highly regulated by the gut microbiome. When your serotonin is off, because your gut microbiome is off, you may experience symptoms of a depressed mood. When your GABA is off, because your gut microbiome is off, you might experience symptoms of anxiety, panic disorder, and honestly, it's also been linked to conditions like schizophrenia and ADHD. So as you can see, it's really important to have a healthy lifestyle to foster that healthy gut microbiome. All right, it looks like we're going to take a detour again with this next question. And this one comes to us from Denise. Thank you for sending in your question, Denise. And Denise asks, through our YouTube, here we go. Dr. Kaur, I'm supposed to get a fluoroscopy next week. And I want to know how soon after the procedure can I return home on a train with a responsible adult? Thank you. It's my pleasure to help answer this for you, Denise. Now, speaking of fluoroscopies, this is a procedure. I want to kind of back up a little bit and tell our viewers who may not know what it is. It's a test that we use to evaluate various parts of the body. And even though it's simple, it's non-invasive, and it's a painless test, it can take anywhere from 30 minutes to 2 hours. So it really depends on what part of your body the test is looking at and evaluating in order to determine what you're going to undergo during the test. Are you going to be sedated? Because sometimes that's a necessity. And what to do afterwards. For instance, if you are sedated, then your instructions for after the test are going to be different from somebody who had a 30-minute test and didn't need to be sedated. Either way, this is something I encourage you to talk to your ordering or performing physician with. They're going to be the best apt at giving you the recommendations that are personalized to you. Either way, I hope your fluoroscopy and your testing goes well and everything comes out just clean. Now, we have another question that came through to us from our website, and this one comes from Zuriel. Excuse me. Zuriel asks, "Hi, Dr. Kaur. I've had gastrointestinal issues for the past 5 years. I've been reading a lot lately about things like leaky gut syndrome, microbiomes, pre and probiotics, fiber, and so on. Are there any specific screening tests that you recommend for assessing gut health?" Suriel, I really appreciate you reaching out with this question because I get this question in my practice a lot. The more research that we do on the gut microbiome and the more we know how it's correlated and how it affects our overall health, the more curious people are to know, hey, what does mine look like? You always want to start out with the routine recommendations that your primary care physician gives to you at your annual physical exam. Those recommendations are tailored to you, to your risk factors, and to your past medical history. So that's where you want to start always. On top of that, if there's extra testing that you want, well, to be honest with you, while there's several of these. I apologize. I wanted to say thank you for your tests, for your questions, everybody. I hope I've been able to answer them. We'll see you next time.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.